Hi, this is Dr. Tuttle. Today's topic is high blood pressure and how chiropractic can help that. So, first of all, what high blood pressure is let me explain a little anatomy to you first. Your body has hundreds of miles of blood vessels in your system, in your physiological system, and what happens is that the wall of your blood vessels is muscular. It's called the tunica media, is the name of the muscular wall of your blood vessels. And what that muscular wall does, it has nerve endings that flow in to the muscular wall of your blood vessels and will cause the blood vessels to either constrict or to dilate. It does one of those two things. It will constrict or dilate. And that's what the nerve messages tell the blood vessels to do, is to constrict or dilate. So if it's dilated, it allows better blood flow. If it's constricted, it causes pressure on the flow of that blood. Thus, you hear the symptoms of high blood pressure. So it's squeezing the blood. It's trying to, it's like if you have water flowing through a hose and all of a sudden you narrow it down to a straw. Well, then there's a lot of pressure on that water as it's flowing through a straw versus, let's say, a regular garden hose. And so you want your blood vessels to stay dilated for increased circulation and blood flow. A lot of smokers will have damage done to the muscular wall of their blood vessels from just the chemicals from smoking. It will actually cause the damage to that muscular wall, causing it to be like a pair of socks that have been worn too many times. They lose their elasticity and they just become flaccid and can even weaken the wall. So it's what's important in chiropractic is that we keep the nerves healthy that either dilate or constrict those blood vessels. And we see lots of patients that come in with, for instance, neck pain or lower back pain or mid back pain or sciatica or stomach issues or menstrual problems. But then while they're there, one of their other symptoms they have is high blood pressure. And maybe they're on medication they've been on for years or maybe just for a short period of time. And as they're being adjusted or put back into alignment and taking the pressure off the nerves, then all of a sudden they notice, geez, it's really strange, but ever since I've been getting the pressure off my nerves, my blood pressure has gone down. Because when the pressure comes off the nerves, it relaxes the nerves, causing messages to be more clearly communicated to the muscular wall of the blood vessels and causing them to dilate, allowing less high blood pressure as a symptom. So we have lots of patients that come in that are on medication for the symptoms of high blood pressure. But just remember, the cause comes from pressure on the nerves that are causing those blood vessels to constrict, putting a lot of pressure on the flow of the blood as it flows through the blood vessels. So, as in chiropractic, we like to make sure. Typically, there was an article in USA Today in the newspaper, I believe it was a little over a year ago, where they had a big article about if you want to lower your blood pressure, get the pressure off the nerves at the base of your skull, which is a very common area causing the blood vessels to constrict. So we encourage people to get checked, to get the pressure taken off the nerves that can open up those blood vessels and keep the blood flowing without that interference, and that will make a huge difference in your health. Thank you for your time today. If you'd like to get checked to see if you have pressure on the nerves that affect your blood flow, we'd be happy to do that. We do that complimentary at no charge. If you'll go to our website, yourseattlechiropractor.com, and fill out the contact information, we can send you a gift certificate for a free initial examination at no charge. If you have any questions, by all means, you can contact me personally. You can call our office at 206-467-8611 and leave me a message and your phone number, and I'll be happy to get back to you and answer any questions you have. Thank you for your time today, and I look forward to talking to you soon.